Hi, I'm Dr. Fitz at North Edmonton Chiropractic Clinic in Edmonton, Alberta, Canada. And for all you YouTubers out there, we want to explain to you X-ray under fluoroscopic X-ray, which is a special X-ray which we don't do too much in Canada because there's a lot of radiation. But it is a motion X-ray. It's an X-ray of a person as they're moving through time and space. So most time when we take X-rays, it is a static picture of a person not moving, and there's just so many positions, and you get a front view, what we call an AP, and a lateral view, and maybe an oblique view. Other than that, people get CAT scans or MRI, and those are to see the soft tissues or damaged discs or ligaments or muscles. And But this is a special X-ray called a fluoroscopic X-ray, and it shows the motion of the neck in this case while a person's moving. And I think it's unique and beneficial for people to see what your body can do and what your body's doing inside, underneath all that tissue, the skin that you have, and give you appreciation for the ranges of motion of each bone as they move through time and space, and flexion, extension, rotation. So I'll point out the joints, the discs as this person's moving. Here's their jaw, their teeth, their jaw, and the neck. Flexing forward, you see the flexion. You can see here that there's a space between each bone. Each bone has a disc space between. That's the light cutting out. It's not me doing anything. Now they're looking back, extending their neck. You can see the curve in the spine. It's tilting forward to its maximum flexion as each bone moves and slides over the other one. Posterior part, or the back of the neck, is where the joints are. That line is the joint of a knuckle joint, like your thumb, in the back of the neck. And each spinal bone has 4 of them. One with the bone above, one with the bone below, and on a left and a right side. So there's 4 knuckle joints to each vertebra. Now this is an oblique view. This is a view that we take as an X-ray, but it's just a one-time picture. But you can see that the person's has little holes where the nerve comes out. This is called the foramina. And when they tilt their head forward, you see that it opens up. When they tilt their head up in extension, the hole or the foramina gets smaller. Now if you have calcium building up in that area, now they're turning their neck the other way, you're going to have compromised foramina, and you can pinch your nerves in your neck. So as you get arthritic and you get calcification in the back of the joints of your spine, and you do extension, you'll find that you'll have more pain or arm pain possibly as you look up, because you're actually decreasing the size of the foramina. So to understand, where your X-rays are, if we take X-rays of you, the best is to see what a normal looks like and then compare to the normal. I think it's like Sesame Street. One of these things doesn't belong here. Can you guess which one? If a person is shown what the normal looks like and you show what's not normal in their X-ray, they're smart enough to see the difference, and a lot of people appreciate that knowledge. So we show X-rays at North Edmonton Chiropractic Clinic, and we explain the difference between what their X-ray is and what a normal is, and if their X-ray is normal, then check mark, and they're happy. But if there's something that needs to be corrected, then at least we can see it and we can address it. Thank you.